Okay, so for our sensation testing, we're going to grab first of all a light touch sensation, so cotton wool bud or piece of tissue that I've got here, and then we'll do our sharp blunt after. Essentially we're going to start with C12, so I'll just laterally flex slightly, rotate slightly the head, and I'm just going to do in here, and I would just ask Brad whether it feels the same both sides. So I do this both sides, does it feel the same? And you look for whether it feels different or whether it feels the same. So that'd be your C12. And then you've got your C3 would be more into lateral neck, a little bit lower down, so test there. C4, clavicle into shoulder. C5, outside of the deltoid, lateral part of the arm. Then C6, I'm going to come all the way down into the thumb, so just doing thumb pressure. C7 would be middle finger, so I do middle finger. C8 would be little finger, and then T1 would be ulnar side of the forearm. Okay, and I'll do that both sides, and I would just check for whether the sensation felt the same, any tingling, any lack of sensation on all those movements. And then we're going to come back in a second, and we're going to do exactly the same with sharp blunt. So with sharp blunt, we do exactly the same. On the reflex hammer, I've got a little sharp ending to the reflex hammer. So what you would do, the same thing, so you just pick the points, C12, C3, C4, C5, C6, C7, C8, or little finger, and then T1. And then we do the same with the blunt object as well. And what we're looking for again is whether they can feel whether it's sharp or blunt. So you do sharp or blunt, and you randomly do that, and you'd say what can you feel, sharp or blunt, and then also you do that from one side to the other, and you'd be checking for whether they've got that pinprick sensation. Hi guys, thanks for checking out the video. Hope you enjoyed it. If you did, then please leave us a thumbs up and share the video so that we can grow the channel. Also, don't forget to subscribe, and this is so that you won't miss out on any of our videos on strength training, physiotherapy and rehabilitation. Should be some videos knocking around about the screen which you can watch, which is some of our other stuff, and I will look forward to seeing you on the next video. Cheers guys.